I was having problems driving at night. The lights just on the oncoming traffic were just all blurring, and I wasn't feeling comfortable on the road.
Everything just blurred, everything kind of blended in together, and nothing really defined.
You make a little mark or reading the measurements. I had a harder time seeing that and trying to line up on a table saw, line to line up with the blade, especially if you're doing a free-handed.
Hi, I'm Dr. Kiessling. Even though there is no known way to prevent or reverse cataracts, vision can be restored by a very common surgical procedure that replaces the cloudy cataract lens with a permanent artificial lens called a lens implant. This lens implant requires no special care or handling. In fact, the only way you know it's there is by the dramatic improvement in your vision.
I started out with, one night I'm sitting and I went to rub my eye and I shut this one. I couldn't see nothing out of my left eye. So I thought, oh boy, now I'm gonna have to do something.
I had cataracts before I probably knew that I did. Doctor thought it was time that they should be removed, and that was kind of scary.
I've been a type 2 diabetic for 13 and a half years or so when I first discovered it. I had a hard time seeing the rows on the combine and the corn and stuff. And that first part of March, I couldn't hardly see anymore. I said, oh, that's it. I had to quit driving and everything, so it was getting high time.
These patients underwent small incision cataract surgery. They had no shots, no stitches, no pain, and no eye patch. Under a microscope, I make a small incision on the edge of the cornea. The cataract lens is located just behind the iris, which is the colored part of the eye. Through the dilated pupil, I open the front part of the sac that covers the lens. We call this sac the lens capsule. Using a tiny ultrasound probe, I divide the cataract lens into small pieces and gently vacuum them from the lens capsule. After removing the cataract lens, I place a foldable lens implant through that same small incision that was used to remove the cataract. Once inside the eye, the lens implant unfolds into the same capsule that previously held the cataract lens.
Well, I wasn't sure what it was going to be like, but it was very easy. It was very relaxing. There was no pain. With the medication you get, I think it kind of relaxes you more. But Dr. Kiessling kept asking different questions, you answer, and I think it was enough to keep your mind off of what's going on.
After I'd had both cataract surgeries, I didn't have to wear glasses anymore. And I had been wearing glasses since I was 10 years old. The sky seemed so much bluer. The houses across the street seemed to have more distinct lines. The TV was easier to watch. Things looked sharper than they had for me for a long time.
And at the end, I remember going down the hallway and, I could just see everything just perfect. It amazed me how much I really could see. I think I got binoculars for eyes now. When I plant, I can see the more road marker a half mile away. Colors bounce off of stuff. I can see stuff. I feel good. It's a lot safer driving when you can see what's going on the road. I can tell you that much.
After I had this done, God, I could see everything again. It was crystal clear. So I was very, very happy I went and did it.
These patient experiences are typical of most cataract surgeries. In fact, cataract surgery has one of the highest success rates of any type of surgery. I hope this video has helped you understand and feel more comfortable about the prospects of having cataract surgery. After your eyes are dilated, I will examine your eyes and explain my findings. Together we will decide if you should proceed with cataract surgery. Make sure all your questions are answered. I want you to be well informed and comfortable on your journey to better vision.